Welcome back, viewer. We are continuing to talk about cancer of the prostate. Very sensitive topic that we are handling here, that is affecting our old man there at home, our big brothers, our grandpas. These are very sensitive issue. You know, in our African culture, with so many myths and beliefs that surrounds sexual reproductive, sensitive issue. How do you handle it in case we come across the signs and symptoms that we have been talked about, the clinical features? How do you handle it? At diagnosis, do you have treatment? In studio with me, I have Bet, and he has been talking to us about taking us the journey slowly from the clinical features. Remember to hit our social media handles at GBS TV Africa, SMS line 21144. Now, Bet, before we took that break, we were talking about radiotherapy. Then you mentioned something about the hormonal treatment, the castration. That word sounds so big. It can even make maybe our people to fear going to seek the treatment, because somebody is imagining, if I come to Bet, I'll be castrated. But at the end of the day, it's for the better. Kindly demystify that hormonal treatment that you say that you normally inject underneath the skin.
Thank you so much. And on the side of castration, as you've said, I think that is one of the very key area that many patients, not only one patient, will be asking, what will be my life after this castration? But actually, in all modalities, we do obtain consent. We do share a lot of information to the patient so that he make an informed choice.
So in that one, is it also, you have also to involve the spouse?
Yes.
Because at the end of the day, you are treading on dangerous waters.
Yes. Now, it's very key because we need to inform the spouse so that as far as also sexual integrity or the status is taken care of, we need to inform the spouse, because this is one of the treatment as a side effects. As you remember, the testicles are the key areas that really make the androgen, or they have the sex hormones, which actually maintain or keep the sexual activeness of a human being. So when we want to approach the modality, we need to inform the spouse, so that we have the consent. We share with them the side effects. That is now the sexual urge after, the sex hormones which are responsible to maintain the sexual part of this are well taken care of. So we are able to access and have those sessions.
So it's locally available here?
Yes, available in the country. And we are able to have, in fact, it has the less side effects, because actually now the focus is to the tumor only. We are not having many others, because actually we really have our focus to the tumor directly, and they are administering the maximum doses. So the outcome for the brachytherapy or the putting the implant on the tumor directly will have a good outcome, and it really has brought a breakthrough in as far as prostate cancer management is concerned.
Wow.
Yes.
I'm looking at that viewer, maybe he's wondering, after diagnosis, should I fly outside the country for the best? But thank you for the clarification. You have said this treatment is locally available here with us. Now, still on treatment, the side effects of chemotherapy or radiotherapy. This patient has been put on radiotherapy. What are some of the side effects that my viewers or our viewer could experience during the treatment, so that they'll be well informed, and that worry, at least it will be minimal, because at the end of the day, I'm informed. An informed person can make a good decision. I know these side effects that I'm going through, these are just normal, and they'll come to an end. What are some of the side effects they expect while undergoing through radiotherapy and chemotherapy?
Thank you to our viewers, and thank you for that question, Ben. In the management, as far as management is concerned, for the modality of chemotherapy and radiation, let's start with chemotherapy. These are the drugs which I've said are very hazardous, and at some point they do a lot of, as far as they're working on the abnormal cells in the tumor, that is in the prostate, they're also destroying the normal other cells. And the doctor and the team which are managing the patients do share a lot of information. Because we have the nausea and vomiting as one of the key side effects, especially when you're on chemotherapy, where you find a patient vomiting immediately after the starting of the therapy, that is chemotherapy, or when they go home, that is 24 hours, or when they are coming now, because they have introduced now to the new drug to their bodies, when they're coming back next, they will have that we call mental, this mental issue whereby the patient will have a psychological kind of approach, whereby the patient approaching upon seeing the doctor with the white coat, or approaching a pharmacy or the room where the patient was given the chemotherapy. That's why we have the one that patient anticipating, that is to vomiting. So there's drugs which are given to the patient to take care of the same.
Okay.
Yeah. And also there is, I've talked about the mucositis, that is now that these drugs also work on the highly dividing cells, and the most common are the one that we have in our mouth going down, we call the GIT. So there is also patients are being taken through the same side effects, so that they have some how to take care of their mouths when they are at home. That there's some also drugs which are used for mouth care while they are at home to reduce such infections, and because actually when you go through this chemotherapy, there is those working on your mouth and destroying the normal cells in the mouth, so you are likely to have some we can call the sores that are very painful, especially when eating, and these are the route entry for the infection. So the doctor also will still prescribe the drugs to take care of the same. On the side of radiation, fatigue is very very common, because the destruction of the cells are too high in the body, and imagining this person is going for quite a number of sessions. It can go as far as 25 or 30 sessions. So we encourage them actually at home to have prescribe bed rest, not to rest at all time, but also to have a way of doing some exercise, take care of themselves, hydrate a lot, take a lot of water, take also the food which is rich in energy, so that they give them energy to go on with this journey. So those are the common side effects, but we do share with our patients, and we have things in place to ensure that we take care of these patients with the same side effects. Another, there is a skin changes or erythema or something, we call it. The skin will have some sores, because actually having high doses with the number of sessions that the patient will go through can get some sores, and actually we encourage our patient to take care of the site where there is being radiated. And that's why we avoid the perfumes, because of the reaction that may occur from the skin. Also can apply some to keep the skin moist, and also continue hydrating, and also avoid constricting clothes on the side of the where there is radiated, so that we reduce these other side effects. So we do share and ensure that our patients are well informed on how to take care of these side effects. Yeah.
The good thing is that there are ways of management.
Yes.
Thank you for that very elaborative answer. And I love it, because at the end of the day, there's no side effect that you have talked about that has no management part of it. At least there's a way of managing it, so that our viewer cannot be afraid or shun the treatment, saying, I'll develop these side effects and there's no way out of it, so let me just stay at home and wait. It's a good thing. Now, like in most cancers, this prostate cancer, is there a place that it normally, how do I put it? Let me put it, is there a place whereby it can move to besides the prostate gland? Because in most cancers, we learn that they have the capability of moving from one region of the body to the other. Do you have any site that it can move to, or it just concentrates around the reproductive area and that's it?
Thank you. For our viewers, it's a very important question, because All cancers do move from one place. They have that ability to move from one place to another.
Okay.
Prostate cancer is not spared on the same.
Okay.
It will move to the lungs, to the liver, to the bones, and mostly to the bones, because you find the elderly people complaining of abdominal and back pain, bone pain. Those are the most common sites: the liver, the bone, and the lungs, and even can go even up to the abdomen, causing the other symptoms. Depending on where the cancer causes, it produces the symptoms based on the pressure which is applying on the certain area.
So it also depends with how long.
Yes.
Maybe it has been there.
Yes.
Yeah.
Because actually it's part of the development for the staging, because in staging we want to see is still localized or has moved to another. So prostate cancer do move, especially the bones, the lungs, to the liver, and other parts of even up to the brain.
So what I'm getting is that also our older people, when they complain of back pain, should you also begin to think about, could I be dealing with a much bigger issue?
Yes, thank you for the same question. When we are on treatment or we are on active management of prostate, we keep a check by these are prescribed. Apart from the blood works that we do check, also there's some scans that we can do to keep an eye and check on the other parts. So we can do a chest X-ray to check on the lungs. Okay. We can do even the spine X-rays or the MRIs to check on how the spine is, because actually those are the areas that actually go, and when they are there, they produce other something called oncological emergencies. Like when it's in the spinal, it can compress the spinal cord, and we have now the oncological emergency, which is very stressing, especially in management as far as management of prostate cancer is concerned, whereby the bone, the tumor cells can press on the spinal cord, now producing the signs and symptoms of now unable also to pass completely urine, or unable to control now the bladder, or retention. And when we have urine retention, we will destroy our kidneys automatically. When we have spinal cord compression, we may lose the lower part of the limbs for this gentleman. And actually, we do check on the same. And when this happens, there is other ways on how to manage, especially when we have spinal cord compression. Part of the radiation can be done on the same to relieve the spinal cord, so that this gentleman restores back to normal life. As far as we manage this
But you're getting more and more interesting. I just want to listen to you more and more, because I'm learning and I'm picking up so many things, so much stuff, content. But due to lack of time, maybe we can organize for another day. We talk about it, because I think our men outside there, they need to learn a lot about this thing.
Yes.
Now, maybe you can look at that camera and give your parting shot. And what do you tell your men? Men, our brothers outside there, then if somebody has listened to you, how can they reach you? Your social media handles or your contacts, how can they reach you? Okay,
my parting shot, early detection is key in management of this cancer. And I will request all men, as you approach 45, 50 years, remember there is changes in your prostate, and you need to keep an eye to check, is it the prostate cancer? Then there is modalities in place to take care of the same. Get me on my Facebook handle, that is Alex Bet, and also my phone number 0717 599 781. Let me repeat again, 0717 599 781. Thank you so much.
Thank you, Bet. There you go, viewer. You have heard from him. It's only because of lack of time, but he could have continued talking more and more. I know you have so many burning questions. You can still reach him via the handles that he has shared. Also reach us at GBS TV Africa, our SMS line 21144. I started by quoting Robert Ulrich. He said, "A healthy outside starts with a healthy inside." Ours is just to give you the information so that it can build from inside and make that informed decision. And you can go out there and you can become healthy rather than sitting down, hurting slowly in bed, as he has said, my guest has said today, you come at late stage where it will be almost management will be towards the end. It will have spread. Viewer, hit our social media handles for questions, for queries, for comments. And remember to keep it at GBS TV Africa. Our SMS line 21144. I've been your host for the day, Ben Bella Onyino. Till next time, bye.